Long overdue nurse talk. I just have one question for the nurses working at the bedside. What are we going to do? Like, what are we going to do? Because the way bedside nursing is looking, it ain't looking good. That's the first part. The second topic I want to touch on is, what are you all doing to prepare for your future? Because the way things are looking as far as nursing is concerned, America is going to be a country that won't have nurses. I know you guys might think that's a bit extreme, but the way nursing is set up right now, the way things are going, this is going to be a nurseless country eventually. So number one, the nurses working at the bedside. I am in direct care on a PRN basis. First of all, let me back it up a little bit. So you all know part of my nursing experience, a good bit of it, is being in the ICU. I worked in the ICU. I, at some point very early in my ICU career, toyed with the idea of going to CRNA school. But then I had to say, who am I fooling? First of all, I'm not trying to do that heavy duty kind of schooling. It's too much for me. I am also not willing to not work and not be able to support myself. I don't like science that much, and some of the schools was wanting you to do the GREs. They want you to take organic and inorganic chemistry, physics. I ain't got that kind of time. I'm just being honest. This is not to discourage anyone. I also don't like the cold. So what would I be doing in anybody's operating room where it's cold as hell? Plus, I'm very wayward. I like to get up, tell somebody, watch my patients. Ask, not tell. Ask somebody, can you watch my patients? I like to go downstairs. I like to take a little stroll. So I'm very own way. I can't be in nobody's OR stuck trying to keep people alive while they're on the table. So I dismissed that idea. But being in the ICU was also a strategic move for me, because being there meant that I only cared for 2 patients, 2 bodies. Yes, those 2 patients might be very sick, but it's only 2 of them, and all my resources are here. So it was a no-brainer. Like, why would I be on MedSurg or IMC or Tele running around like a chicken without no head? So most of my career was spent in the ICU. However, since working in mental health, I recently transitioned out of the ICU. It was my choice, because I decided, actually I didn't decide. I think it's just part of my destiny. It was ordained, right? In my gut, in my spirit, I had no desire to care for patients in the ICU setting. Like, I had no desire to be in the ICU setting. It was so many things about it that turned me off, that over the past few months, I have not worked in the ICU. I was picking up shifts on random med-surg units in the hospital because I was in the float pool. However, the float pool became too demanding. So then I signed up with the med-surg unit that I worked on as a tech. I spent some time there as a nurse. I said, this is my home. It's my safe place. I know exactly how this unit works. I'm going to go here on a PRN basis, not on a float pool basis, and, complete my 3 shifts in a 6-week period, and I'll be good. So that is what I'm doing right now. But I am beginning to question my entire existence at the bedside, simply because bedside nursing today is not what it was 10 years ago. It definitely ain't what it was 30 years ago for a lot of my OG nurses. When I first started back as a tech, not even as a nurse, when I worked as a tech, the nurses would have, let's say, 5 patients. The ratio has not changed much. When a nurse had 5 patients, at least 3 of those patients would be a walkie-talkie, meaning that they were independent, they can get up, they can wash themselves, go downstairs to the cafeteria. Patients was going outside to sit and smoke and have a good old time. Okay, patients were making friends outside while sitting outside in the summertime, right? That was back in the days. Then I became a nurse, and then the patient load, still, I had patients that would go downstairs, or I'll be right back. I have to go outside looking for them because they've been gone for how many hours, whatever. Today, 2023, 2024, those 5 patients, no more self-care patients, none. Everybody's a complete care. Literally, everybody is a complete care. What is happening? Am I the only one experiencing that? Drop in the comments below if you have noticed a change in the patient population. Patients are sicker now than they were 10, 15 years ago. It's insane. The comorbidities are more. The acuity is more. Patients that are in the hospital right now on med-surg need to be on an IMC unit. Like, they need to go to IMC where the ratio is a little bit lower. Patients on an IMC unit need to go to ICU. And patients that are in the ICU, listen. All I know is I went to work the other night. And of course, I had my 5 patients. After getting a report, the first thing I do is I go check my patients to make sure they're alive, right? All of my patients were complete cares. All of them were incontinent. Some of them had finger sticks and needed insulin coverage. 3 of them had like really bad pressure ulcers on their bottom. And I'm just like, how? Then the best part, because people always ask me this on TikTok, or you guys will ask in the comment, well, don't you all have CNAs? Isn't that why there's a CNA there? I told y'all America is going to be a country that's not going to have nurses at one point. They ain't going to have no more CNAs. The CNAs are not... It's almost as if CNAs no longer exist. Let me tell you something about these new girlies out here today. The girls are doing nails. The girls are doing hair. The girls are braiding. The girls are driving Uber. They're driving Lyft. The girls are cooking and selling meals. The girls are babysitting. The girls are dog walking. The days of a young lady who's maybe 19 or 20 looking to make some money, looking to have a job, long gone are the days where people are running to sign up to become a CNA. Because the workload is so much, the demands is so much that these younger folks are like, what? You want me to do what? Stand and take care of who? Hurt my back and pull who on what? I'm not doing that. I'm gonna just go learn how to do nails and get certified on how to do nails. I'm gonna learn how to do some braids and I'm gonna go braid here and earn a coin. That's what these younger people are doing now. Like Gen Zs, even like, they're not trying to be at nobody's bedside taking care of patients. Which leads me to the next topic. The conditions in which patients are today. If patients have gotten progressively worse over the past 10 years, what's going to happen in the next 10 to 15 years? That means they're going to be even worse. And there ain't going to be no nurses. Because here's the thing. A lot of people who are coming into nursing right now, a lot of them are younger. They get burnt out really fast. And there's other things that they go on to do. Like some of them will become nurse practitioners. Some of them will want to go into mental health. They want to go to anesthesia school. The nurses that are coming out these days, nobody is trying to be at the bedside for 10, 15 years. I am the last of that generation. I'm 14 years in. I'm 14 years in. These young girls that are coming out, the 21 to 22 years old, they ain't got time. They come, they do their year. A lot of them like will get offered $30,000 sign-on bonuses, and them girls is like, we don't want it. I ain't trying to have nobody hold me to their hospital. When I'm ready to go, I'm ready to go. That's how the girls are moving these days. So thinking about the future and looking at the condition at which patients are presenting now in the clinical setting, I can only anticipate that the quality of life, the health of the population is going to further deteriorate if we don't start taking our health more seriously. The amount of comorbidities an average patient has, for example, if I get report on a patient on med-surg, this is what the past medical history sounds like. Patient has a history of hypertension, CAD, hyperlipidemia. Patient is a type 2 diabetes. The left leg is amputated. Patient has a wound on the left leg that's not healing. The doctors are considering amputation. Patient is on dialysis, goes to dialysis Monday, Tuesday. Girl, hold on right there. Hold on. That's the medical history, right? So you also have to consider, let's just say a patient gets admitted for a small bowel obstruction. I don't know. That's the first thing that came to mind. Patient gets admitted for a small bowel obstruction, but then they have that history that I just mentioned. So as a nurse at the bedside, you are managing the current diagnosis, but then you also have to consider the fact that your patient's a diabetic, your patient has a wound, your patient already had an amputation, meaning that they're not more than likely mobile, meaning that that patient is probably a moderate assist to complete care. It's a lot. People are sick. So I'm here to ask y'all, what are we going to do to prepare for our future so that way we are not burdening a healthcare system that more than likely will not be able to manage and meet the demands of the population the way things are going. I'm telling y'all, there's not going to be any nurses. For example, it wasn't uncommon for, let's just say, like, I'm a nurse, I have 2 daughters. It wouldn't be uncommon for my 2 daughters to be like, oh yeah, I want to be a nurse just like my mom. When you ask my daughters, number one, my 12-year-old, that girl is something else. But when you ask her, Coco, you don't want to be a nurse? No. No. I told you, mommy, I want to be a software engineer. Okay. The oldest girl, she's 20. She currently works part-time as a dietary hostess in a hospital. And she comes home all the time and she's like, I don't see how you do that job. She's like, I just can't. She's like, I don't see how you do it. So me having 2 daughters, nursing is not an option for them. They're like, no, absolutely not. And that has been the current trend amongst a lot of my peers and a lot of other nurses that have children. Their children are not going into nursing. And a lot of nurses are discouraging their children, even if the child has an interest in nursing. A lot of people are discouraging their children from going into nursing because the job is too difficult. It's challenging. It's not manageable. It's not realistic. It's not feasible. I don't know what else to say. And here's the thing. I don't see any improvement coming. I don't see any improvement because hospital administration, they don't care. And then we have nurses that are in the positions of like being managers. They're up in senior administration. They don't give a damn. They don't care. The other day when I worked, I was getting ready to leave. I was finishing up documentation. And I was overhearing the nurses complaining to, you know, a nurse executive, a nurse that's in administration. They were complaining like, listen, the workload is too heavy for us. We cannot handle it. Yet you guys are keeping us at the same ratio. The fact that the patient population has gotten sicker on a med-surg unit here in Maryland where a nurse will get 5 patients, that nurse really should only be getting 4 patients because the patients are sicker. They require so much more care that it is almost impossible. And guess who's suffering? The patients are the ones suffering. The patients are suffering because they're not getting turned as frequently as they should. They're not getting changed as promptly as they should. Because let's just put it like this. I go in, I have 5 patients. They're all 5 complete care. The first patient I have to see is my little pop that's trying to climb out the bed. He slid all the way down. He all the way down to bed. Remember now, we're short on CNAs. So there's only 2 CNAs for the entire unit. One is on this side, one is on this side. The one that's on this side, she's trying to get her vitals in for 8 o'clock, 8 p.m. So I'm in the room with Pop. I got to find a way to put Pop back up in the bed. So what that means is I have to now get creative. I have to unbreak the bed, pull it from the wall, go behind the bed, put it in Trendelenburg. So like the bed is like backwards like this or like this. Yeah. So the bed is like this. And I have to like stand behind and pull on the sheets to get Pop back in the bed. So Pop is not on the floor. So I do that. Get Pop back in the bed. Then I found out, oh my goodness, Pop had a bowel movement. That's why he was trying to climb out the bed. So let me go ahead and clean Pop up. I clean him up, get him nice and fixed up. Okay, cool. Whew. Okay, now let me go check my other 4 patients. I go into the other patient's room. He is slumped over in the bed, looking a mess. Drool is coming out of his mouth. I have to fix him up because I can't just walk out the room and leave him like that. I check. Okay, whew, he's dry. Okay, good. Fix him up. Go to the other room. The patient's on a ventilator. It's a lot. It's a lot. One of the reasons why I even switched from day shift to night shift was because I needed to be able to take care of my patients. Because as a nurse working on day shift, the busyness of day shift, the demands, everybody is always looking for the nurse. The nurse can fix everything. Everybody's always looking for the nurse. I'm talking about in person, the phone call at the desk, and the device that we carry. It's always going off. It is impossible to be the kind of nurse that I was trained to be and that I want to be to my patients working on day shift. So now your girl switched to night shift. And it's a little bit better, but the patients are so heavy. They're heavy. So that is the reason why I want to have a conversation about what are we, like the people now, like us, what are we going to do to help ease the burden later on as we grow older? Like, y'all got to start eating right, drinking water, taking vitamins, and most importantly, moving your body. Like here in America, we have too much of a sedentary lifestyle. Like I noticed today, even at my mental health job, I didn't really move that much. Like we got to do something. We really have to start taking matters into our own hands, because I'm telling y'all, it ain't looking good. We ain't gonna have no nurses. People are tired. You have a nurse like me who prides herself on taking care of the patient. I pride myself on being that fundamentals nurse. However, the lack of staffing, the lack of support, the fact that the young girlies are doing nails and doing hair instead of trying to go to CNA school and then eventually go to nursing school, that has dwindled down. That's becoming a thing of the past, y'all. I cannot take care of the patients in the way I want to because the load is too much. And nurses, we complain all the time. We talk about it all the time. It falls upon deaf ears. Something has to happen. The patients are the ones not getting the care. And that brings me to another point before I close this nurse talk out. A lot of y'all family members got to start doing better. A lot of y'all got to start doing better. Like the fact that you have a family member that's ill and in the hospital, for you to think that your family member is going to get tip-top nursing care, it's irresponsible. It's irresponsible for you to think that, considering the complaints and the outcries and the strikes and all of those things that you've seen over the past year. It is irresponsible for you to think that it is okay to drop your dad off. You come visit him and all you do is sit there. No. Families, y'all got to start getting involved in taking care of y'all relatives and taking care of y'all loved ones, because I can't do everything. I can't. I need help. Nurses at the bedside, we need help. The fact that family members come and they just sit there. Like, you don't have to do it all by yourself. We don't mind helping. But y'all need to start taking more of an initiative. I know I'm going to get pushed back in the comments, but... And here's the thing. I just want to clarify, because, of course, there's always going to be people who are saying, but that's what you signed up for. You just don't want to do no work. You just don't want to do your job. No. The job has become impossible. It is impossible. It's like on TikTok the other day, I posted a video and this one lady commented, she's a nurse, and she wrote exactly what was on my mind, and she wrote exactly what I do when the assignment is impossible. She said actually, when I have patients, I'm doing the patient care. The documentation, they will get it in a narrative note. Because how you want me to take care of these people? You know you don't have a nursing assistant. You know this assignment is heavy. You know the patients are sicker. The data shows the patients are sicker. So how do you want for me to document? Click, 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 click. All the rows, click, 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 click. Document, document, document. Oh, don't forget to do this. Oh, don't forget to get this paper signed. The charge nurse has to come and sign your skin documentation. Like, you want for me to do all of this in the computer. But do y'all know this man is sitting in the bed? Can't move. I'm the one that gotta push him, move him. I gotta call for help. The other nurse is too busy drowning in her mess. We ain't got no CNA. And y'all still want me to document? Now y'all gonna get this narrative note. You're gonna get the narrative note because the chart is a legally binding document. You're not supposed to remove anything from the chart. If I can summarize care, so long as my patient does not have a sentinel event or does not have any type of critical event, if I can summarize the care and the assessment of my patient in a narrative note, that is what y'all are going to get at this point, because you can't get everything. You can't keep making demands on nurses, but you're not easing the burden on us. There needs to be a safe staffing ratio nationwide. Every single nurse, every single state needs to have some form of legislation, some form of intervention saying that hospitals cannot dump 5, some states 6, 7, 8 med-surg patients. Are y'all wild? Are y'all crazy? That shit is distressing. It's demoralizing. Like, to have to come home as a nurse and sit and, you know, run through your mind and kind of make peace with the fact that you tried your best, even though you couldn't get everything done. You really, really tried. It's morally distressing to know that, damn, I really would have liked to turn that patient more, but I just couldn't because the load was heavy. Time wouldn't allow. I had 4 other patients that were complete care that we needed to take care of and give medicines to and do documentation and measure wounds and do wound change and bathe them and all of those things. Like, it's a lot, y'all. It's a lot. But it's Saturday night. I work again in the morning. I go to work for 6:30. You guys know I'm at a mental health inpatient facility where I work with adults and adolescents suffering from eating disorders. I'm supposed to write a paper tonight for school, but I ain't got no charger. I forgot my charger at clinical. My iPad dead, my computer dead. I should have stopped at my daughter's, at their dad's house and got a charger for one of them, but I just came home. I'm tired. I'm gonna take myself to bed and I will catch you all in another nurse chat, nurse talk. What do I call it? Nurse talk. All right, let me know in the comments what you guys think, okay? Bye.